the staff they need to provide the quality care. I am very proud that here in the state of Vermont, we have expanded community-based outreach clinics, improved the facility at White.
Was more lack, want, suffering, depression, stifling of the human spirit, and death than any other system in the history of the world. And this Venezuelan system is what Senator Sanders wants to bring to the shores of the blessed country of the United States of America. He laughs.
Of course I'd laugh at you.
He's laughing.
You know, what you're doing is echoing your good friend, the president.
I'm not echoing anyone. These thoughts come from my mind and my heart.
Really? Well, they echo your...
I don't listen to anybody else.
Excuse me.
These are my thoughts.
Well, they're pretty pathetic thoughts. Because what you are doing is doing what Trump does. You're equating what I have to say with Venezuela, which is a failed economy. Why don't you equate it with what goes on in Denmark and Sweden?
Capitalist systems.
Excuse me, which provides health care to all people as a right, which provides free public education through medical school and graduate school, which has a tax system that is fair and progressive, which emphasizes environmental protection, which has early childhood education, which would be the envy of the world. So please do not give us this nonsense. Vermonters know me a little bit better than that. They know that I do not believe in authoritarianism. In fact, I am fighting right now and running around this country to oppose Republican efforts to suppress the vote, to make it harder for poor people or people of color to vote. I have spent my entire life trying to revitalize democracy, to make this country as democratic and open, as free as possible. So do not equate.
Is that a red light over there?
You've had a red light too. Look, you guys just...
So do not equate what I'm doing with the old Soviet Union or Mao Zedong or Venezuela.
I'll refute your notion that the Scandinavian countries are socialist countries. They got their money, and they get their money by having capitalist systems. They are able to have a bigger welfare system because guess whose military umbrella protects them? Their healthcare system is full of rationing, and they also piggyback the billions of dollars of medical research that's done in this country that enables them to spend less on medical research. So these countries that you love to champion, these Scandinavian countries, they're rock-solid capitalist countries. Furthermore, there's top populations of 5 to 10 million. Norway, North Sea oil, that amount of wealth has given them enough money to feed and house and clothe everybody in their 5 million population. So the Scandinavian model is not the one. The one to compare Senator Sanders' policies to are Cuba and Venezuela and North Korea, because that's where socialism has in fact failed. He loves to rail against authoritarianism and oligarchies as if that's what we have here. We have a president that's elected. We have a Congress that's elected. We have a senator that's elected. You know where you have the authoritarian oligarchies? In the socialist countries where Senator Sanders used to like to champion, like Venezuela, before the people started dumpster diving for dinner. Then he stopped talking about that.
Okay.
That's simply untrue. To sit here and suggest that I am sympathetic to the government of North Korea, which is a brutal dictatorship, which has led its people into starvation and all kinds of horror, is, you should do a little bit better than that, Mr. Zupan.
Take Venezuela.
Absurd.
We're going to stop here.
Venezuela.
And do you have another question for Lawrence Zupan?
Yeah, I do. When people like Mr. Zupan talk about the genius of the markets and blessings of the markets, usually what they are talking about is more tax breaks for billionaires. Trump's tax proposal, which I voted against, provided 83% of the benefits to the top 1%, is going to increase the deficit by about $1.5 trillion. And then what Mitch McConnell and Paul Ryan want to do is, having driven up the deficit, is come back and cut Medicare, Medicaid, and Social Security. So, Mr. Zupan, my question to you is, would you support cuts to Social Security, Medicare, or Medicaid?
I wouldn't support cuts to them, but what I would support is something you have systematically ignored while championing those programs. You have systematically ignored the $160 billion a year of Medicare fraud, abuse, and corruption. So right there, we could have paid for the college education of every college-age kid for a year. So what I am in favor, and that's emblematic, unfortunately, of big government systems. Look, some big government systems may be necessary. Some of them maybe even do more good than harm. But when we give them a free pass without any watchdogs to see where that $160 billion a year of fraud and abuse are going, that is a tragedy, and it's a travesty, and it has to be stopped. So right there, if we could recover even 50% of the waste and fraud and corruption, we wouldn't have to even have the conversation about scarcity. So that's your answer.
Of course, I haven't ignored the problems within those systems.
What have
but
you
I
done about
think
them?
that they are an enormously important part of America. And I worry very much, you see, and I've been clear on it. Paul Ryan wants to cut Social Security, Medicare, and Medicaid. Are you prepared to tell the people of Vermont that you would vigorously oppose those cuts?
I would not be in favor of cutting Medicare, Medicaid, and Social Security. What I am in favor of is holding every senator and congressman to task for their complete dereliction of duty in eliminating fraud in all three of those systems, in ignoring the Congressional Budget Office's prediction, and that's a nonpartisan government entity, prediction that by 2026, those august programs will be completely bankrupt. So,
River Junction. In terms of health care in general, if you are going to defend a system which allows 30 million people to have zero health insurance,
I didn't defend
even
that.
more who are underinsured,
Don't put words
which
in my
allows
mouth.
us to pay by far the highest prices in the world for prescription drugs, and at the end of all of that, end up spending twice as much per capita as almost any other country on earth, including Canada, I think you're barking up the wrong tree.
Well,
what the American people want, in a recent poll that I saw, 70% of the American people support healthcare as a right.
You want to design and control a system of healthcare for 326 million Americans when you've never even shown that you know how to manage and control anything? I don't know how you're going to do that.
Well,
Senator
I will
Sanders.
tell you how. First of all,
Yeah.
I heard some of your attacks on the VA. Why don't you go out and talk to the veterans
I have.
in the state of Vermont
I have.
and all over this country? And what they will tell you that they are very supportive of the VA, and they are vigorously opposed to any effort by the part of the Trump administration or anybody else to privatize the VA. I'm very proud. You want to criticize me? I am very proud
I do
that I
agree
added
with
$5 billion more to making sure that the VA has the doctors
And didn't fix the problems. And didn't
the
fix the
doctors
problems.
and the nurses work with Senator John McCain on that. Doctors and the nurses and the staff they need to provide the quality care. I am very proud that here in the state of Vermont, we have expanded community-based outreach clinics, improved the facility at White River Junction. In terms of health care in general, if you are going to defend a system which allows 30 million people to have zero health insurance,
I didn't defend
even
that.
more who are underinsured,
Don't put words
which
in my
allows
mouth.
us to pay by far the highest prices in the world for prescription drugs, and at the end of all of that, end up spending twice as much per capita as almost any other country on earth, including Canada, I think you're barking up the wrong tree.
Well,
what the American people want, in a recent poll that I saw, 70% of the American people support healthcare as a right and Medicare for all, and I will fight for that.
So you will fight for expanding a system that you have never fixed in the first place.
I have never fixed.
Yes, you were the chairman for 2 years of the Veterans Administration, and though you threw $16 billion at it, it still suffers from all of the inequities and waiting and suffering of our precious veterans that it did before you got there. Look, if you can't fix and make to work a system for 21 million people, how are you going to make a system work for 326 million Americans? It's just not going to happen.
I think the answer is that it is very easy to pick apart any healthcare system, whether it is a local hospital, whether it is the VA, which has 146 medical centers, and say there's a problem here. There are problems. There are problems at every medical facility in the United States of America. There is a problem when we spend twice as much per person on healthcare as do the people of any other
That's
nation.
because we
But
have
what
the
we have got
biomedical
to do
research.
In
You know what?
terms of healthcare, what we need to do are two things. Number one, we have got to agree that healthcare is a right, not a privilege. Guarantee healthcare at all. Number two, we have to do away with the bureaucracy, the waste, and the dysfunctionality of the current system, which costs us so much money, and make it into a cost-effective Medicare for all system.
We're going to stop right there, and we're going to move on to questions that our listeners have sent us, and we'll be doing that after this break. This concludes the second segment of our program. You are listening to the VPR Vermont PBS U.S. Senate debate live.
And we'll rejoin the Vermont Senate debate in a moment, courtesy of Vermont PBS. We'll have more debate coverage coming up here on C-SPAN tonight at 8 Eastern. Live, Kentucky's 6th U.S. House District debate between Republican Representative Andy Barr and Democratic challenger Amy McGrath. Democratic Senator Joe Donnelly faces his two challengers, Republican Mike Braun and Libertarian Lucy Brenton, in Indiana's U.S. Senate race. From the Toby Theater in Indianapolis, live coverage tomorrow evening, and that starts at 7 p.m. Eastern. Also coming up, Wednesday night at 8 Eastern, Republican Representative Tom MacArthur debates Democratic challenger Andy Kim in New Jersey's 3rd District U.S. House race. Watch live coverage Wednesday night at 8 Eastern on C-SPAN. And a reminder that you can watch all these debates online at cspan.org and listen with the free C-SPAN radio app. C-SPAN, your primary source for campaign 2018.
VPR Vermont PBS U.S. Senate debate on Vermont edition. With us today are two candidates for the position, the incumbent independent Senator Bernie Sanders and Republican challenger Lawrence Zupan. Now for some questions from Vermonters, and I want to thank everyone who submitted questions in advance of the debate. Candidates, in this case, please do limit your answers to 60 seconds. And we're going to start with a question from Dave in Middlebury, who asks, if elected, what will you do to protect Vermont's choice to legalize cannabis from Jeff Sessions' promised crackdown on states that have legalized? Lawrence Zupan, you go first.
Well, I believe that a decision like that is best left to the states. I think there are many decisions that the Constitution declares, if not in the province as constitutionally declared by the Constitution, to be a federal responsibility, that it devolves down to the states. And that clearly would fall under that category. And that is an answer that is separate from whether or not the desirability of passing such a law and having cannabis freely available recreationally is a good idea. I've had a lot of anecdotal as well as academic evidence from Colorado that it's not exactly the paradise that it was cracked up to be. So I think that though you may favor recreational marijuana being legalized, I don't think it's a great idea personally, but I want to make a big distinction between that and the medicinal uses of cannabidiol, which has shown great promise in treating many different ailments.
Bernie Sanders?
We have a very broken criminal justice system in which we end up as a nation having more people in jail than any other country on earth. And one of the major flaws of our broken criminal justice system is the fact that we have fought an unwise and destructive so-called war on drugs. Right now in Washington, is in part of the Federal Controlled Substance Act, marijuana is at the same level as heroin, which is basically insane. I believe that we need fundamental changes in our criminal justice system. I do not want to see lives being destroyed because people were arrested for possession of marijuana and then get a police record and maybe not be able to get a job or housing or go to school. So I happen to support what Vermont has done and what other states are doing. If people want the right to smoke a cigarette, which I am not in favor of, I think tobacco has done enormous harm, that's their right. And certainly people have the right to smoke marijuana.
Let's go to a question from Patricia. Patricia says, I find it abhorrent that the U.S. is one of only 2 countries in the world, New Zealand being the other, that permit drug companies to market prescription drugs directly to consumers. Their budgets for this marketing must be enormous, and I would think that these dollars might be better spent developing new drugs and or lowering the prices on the ones we already have. What do you think? Are you willing to take on Big Pharma on this issue? Senator Sanders?
Well, I think most people in Vermont know that I have helped lead the effort with some success. Back in the late 1990s, I was the first member of the United States Congress to take people across the Canadian border, where women in Franklin County were able to buy breast cancer drugs at a fraction, 1/10 of the price that they pay in the United States. Bottom line is, the pharmaceutical industry is the most greedy entity in the United States right now. They have spent billions of dollars in the last 20 years on lobbying and campaign contributions to create a climate which says they can raise their prices to any level at any time they want. The result, they make billions in profits. 1 out of 5 Americans cannot afford the medicine their doctors prescribe. I am working on continue to work on a series of pieces of legislation that would substantially lower prescription drug prices in this country and stop the incredible greed of the drug companies.
But Patricia specifically wants to know about marketing direct to consumers. Would you try to
On
stop
television,
that?
absolutely. They spend huge amounts of money, and then they charge high prices for that. I will trust the medical community to tell me the kinds of therapy that I need, the kinds of medicine I need, not a 30-second ad paid for by the pharmaceutical industry.
Lauren Supan?
In our home, it's a joke.